Hello, this is Dr. Grande. Today's question is, what is the difference between acute, chronic, and complex trauma? Now, when I use the word trauma here, I'm referring to trauma as it's looked at in the definition of posttraumatic stress disorder, a mental health disorder that requires a traumatic event, a qualifying traumatic event. So these different types of trauma are used in sometimes in determining what kind of care would be appropriate or necessary. So let's start with acute trauma. Acute trauma is also referred to as simple trauma. And this usually means when there's one traumatic event in someone's history. And that would be potentially, of course, the focus of treatment, or it may have led to post-traumatic stress disorder. But either way, whether there was a diagnosis of post-traumatic stress disorder or not, this would just involve one event. So this could be a motor vehicle accident, a natural disaster, or a workplace injury, something where the event just occurs one time. Now, sometimes we do see across somebody's lifetime multiple traumatic events, but only one is believed to be etiological, that is, causal to post-traumatic stress disorder. So, for example, someone may have 3 or 4 different motor vehicle accidents in their history, but one accident is really leading to the problems, the symptoms. So this would be considered a simple trauma, even though there are multiple events. So now moving to chronic trauma. So with chronic trauma, we have multiple events. So it could be multiple traumatic events of the same type, like being abused repeatedly as a child, or it could be multiple traumas of different types, like being involved in several natural disasters. The natural disasters are unrelated to each other, but cumulatively they could have an effect. This would be chronic trauma. Now, complex trauma is often thought of as being the same thing as chronic trauma. And depending on the definition you look at for complex trauma, that would be true. Sometimes it's simply multiple traumatic events. Sometimes, however, with complex trauma, there's an added set of criteria. And that would include that the traumatic events were perpetrated by a caregiver or another trusted individual. There was a sense of betrayal, and the traumatic events happened during childhood. So with these added criteria for complex trauma, individuals could be excluded from this classification, even though we would normally think of them as meeting the classification. So a lot of repeated traumatic events happen where there isn't a betrayal, where there isn't the involvement of a caregiver or other trusted individual, and of course prolonged and repetitive traumatic events can happen when someone's not a child, when they're an adult. So with complex trauma, we really have primarily those two definitions. The definition where it's just like chronic trauma, and the definition where we have these extra features. So regardless of the exact definition of complex trauma, the reason that this classification exists, why some individuals use this classification, is because we believe that there is a likelihood of seeing particular symptoms or seeing more severe symptoms with complex trauma than with simple trauma. So for example, with complex trauma, it wouldn't be unusual to see relational difficulties, a sense of guilt and or shame, low self-esteem, a distorted self-image, dissociation, difficulties regulating emotions, and a sense of hopelessness or a loss of meaning. Now, of course, all of these symptoms could be seen with simple or acute trauma. It's just that we would not expect that usually. We typically associate these different symptoms with complex trauma. I hope you found this description of acute, chronic, and complex trauma to be interesting. Thanks for watching.